My name's Kelly Paxinos. Yes, I've been married for nearly over 50 years, probably 60 years now. My husband has passed away, but I have 5 children, 2 girls and 3 boys, and 6 grandchildren and a great-grandchild. Well, I was born in Australia, but my parents were from Greece. They came from the island of Ulysses, the famous Ulysses, and called Ithaca. The island was called Ithaca, and they migrated to Australia. Dad came in 1915 when the Second World War had started. Oh no, it was the First World War had started, and married my mother in 1922. At first, I wasn't involved with the professional. They didn't invite me to be part of that treatment program. But because I was a person who wanted to find out things, I went to a library which was run at the time by what was called in those days Schizophrenia Fellowship. It's now Mental Illness Fellowship. I went there to find material to read and understand what this condition my son had, because I didn't know anybody else around my circle anyway who'd had a mental illness. So by going to this organisation, it opened up many doors. And as time went on, I learned more and more. And one of the things that was so important was how I had to handle the situation, how I had to have understanding of how to speak to my son when he was psychotic, for example. These were new experiences, and I would suggest that not many people would really know how to communicate with somebody who's in a psychotic episode. I just felt that the professional looking after my son didn't ask any questions about the incidents of how my family felt. They didn't include them in that conversation with me. They didn't ask to include the rest of my family, for example, which I think would have been a good idea in those early days. They have made big transitions in their lives. A lot of them may come to family who are already here and they can be accommodated and have friendships, but a lot of them come without anybody. After a few years, I met some of these women through the work I was doing when I was working in mental health. And it was very interesting that the actual fact of them coming to this country without language, without people, without knowing anybody, without partnerships, was incredibly difficult for them. And out of that, I met one particular lady, and she married and she had a baby. And the hospital contacted me and they rang me and they said, look, she hasn't got anybody. She hasn't got a mother. She hasn't got a sister. She's the only one she talks about is you. Can you come and visit her? And I remember going to visit her, and it was an incredibly emotional experience for her to see me as a mother figure. And I really realised how many people in this world need their mothers. But I think within the training of all our professionals who are particularly working in mental health, I think they really have to have a really increased study program in the practical area of understanding, because a lot of our people they don't speak their English language very well. They need an interpreter when they're having discussions together. So I think that area has to be looked at very carefully and funded. But one of the things I think that helped these families was that I was a mother. And whether they were parents or whether they were the people with the illness, I think that mothering figure was important. And I can always remember one client came one day and he actually had a diagnosis of mental illness, and he came to where I was working at the Mental Illness Fellowship at the time. It was time for a break. It was nearly lunchtime and I was damn hungry. So he opened up his little violin case and he had an apple and a banana in it. And he said, would you like a banana? So I thought, I can't say no. So we broke the banana in half and we had half each. And I thought, some people with these serious mental illnesses are lonely people. They may not have parents. I didn't know his background, but sometimes they just wanted you to do just normal, simple things. They didn't want great big explanations and theories about different things or treatment. They just wanted that simple feeling of being needed, and him giving me a banana to him was great, was the greatest thing that ever happened to him, I think. And he started singing, and he had a beautiful voice actually, but who knows where he is now. The Salvation Army had sent him, which lends me to think that he may not have had a background of parents. Firstly, they didn't understand what mental illness was. They thought particularly, they saw the behaviours, because mental illness does create difficult behaviours in most instances. So because of that, they often thought their people were bad people, or they were influenced by people and doing these things, or they were doing it to annoy their mothers. So what they really were missing was to understand how to communicate, and that's one of the biggest issues in dealing with people with mental illness, is how do you communicate? So professionals who are in the field really need to be able to talk with family and say to them, how about we discuss how you have a conversation with your person who has a mental illness, particularly when they're going through the psychotic episodes. I think during the time that I was involved with the mental health system, which is quite a long time ago, nearly 20 years now, but we were able to have groups coming together of carers, and I was working within the system at that time, but nowadays there are others who would be working there, maybe could do the similar things. Whether they're doing them or not, I don't know. But we were arranging particular meetings together with carers, with families, to come and have a cup of tea and a scone, not a great big professional way of doing things, but a friendly meeting, so that one mother would meet another mother, there would be a father who'd meet another lady, and we'd have similar issues and we'd talk about them, and we weren't giving them a totally professional way of doing things. We would be giving them our experiences, what worked with some of our families. Would it help you if you did a similar thing? So it was all around the people who cared for their family member, who were talking amongst each other. I mean, they were such simple, ordinary kind of things that needed to be discussed, but you didn't need a professional answer. It was just a common sense answer that you would be doing in your own family home. So I think sometimes people and carers need to hear just those simple kind of ways of helping their sick relative, because they're living with them. I think it's terribly important, because once that father or mother and sisters, whoever they were, came to me, the first thing I would say to them, I'm Kelly, and I have a son who has this particular illness. So you can express yourself in any way you'd like, but talk, open up. If I can't answer a question, I will tell you and I'll refer you on to somebody who can give you a more professional answer to it. And there were times when a few of them would bring some papers that different doctors or whatever gave them, and they were written in quite medical ways, where these people, some of them didn't have much of an education. I mean, the world is very mixed. There are people educated, there are others who are not. All sorts we get a lot of migrants coming now with language issues. So I said, as professionals, you've got to be very careful to understand that it's not a disgrace to use a simpler word when you're explaining something to people who don't speak English very well. I think in some ways some of the professionals that I'd met at that time felt that they had to keep their professionalism in front, but I could see that they weren't connecting with that sick person or the parents of it. And I think that's such an important issue, so that mother or father or even the patient leaves that room knows exactly what you were talking about. Discuss with them the kinds of things that are going to help their person in the home. You're a professional, you know these things. Most of them are mothers and fathers anyway. Yes, so the point is, if you can give them some of those practical things that even you do, because a lot of us, when we have a person of our own flesh and blood who's mentally, we're at a loss how to help them. We wanted them to be like they were before, but they're not like they were before. The illness has changed them. So we often don't quite know how to respond to them. So when you have a professional who understands that and can talk our language, that's simple. We're not clinical people. We're ordinary people. Some of us are a little bit educated, some of us are not. To really understand that the world isn't, and they would have learned some of this in their training anyway, but expand on it, become a little bit, and the more professional you are, the more you should be able to bring yourself down to the level of the people that you're serving. Families would often say to me, well, why didn't the doctor listen to me? Why couldn't I have said something? Or maybe it's because I don't speak English very well, they didn't explain it. Or they didn't bring the interpreter like I asked them to because it costs money. I think if you've experienced something yourself, you're able, or very likely able, to do the same thing and help that person because you've experienced it. A professional who hasn't actually experienced the actual living with a person, they've learned it in a professional way or the book form way, and maybe they've had some experience because they have to do practical work as well. Mental illness is very different from having a heart attack or sore legs or whatever it might be. I think mental illness is now a little bit more acknowledged than it was when I first entered the system, but it's really important that it is up on that top level, because the understanding by the ordinary people, most people who don't have mental illness, they don't understand about it. So I think there needs to be a lot more public education, and it could be done on the film, it could be done on television, it could be done by more articles written maybe in places where the ordinary Joe Blow reads. It's good for people, professionals, to read things, to be written in a professional way, but there's a group of people in our community who for one reason or another don't have that kind of education, don't read those kinds of articles in newspapers. They're the ones that we need to access and to give that simple way of talking and how to discuss with people. Maybe as we've been discussing, I recall the times when I first entered the system, and I realised that a lot of the professions didn't always really understand the carer role, the role of the parent in these. So it needed to be able to be understood by the psychiatrist and or the professionals in the system, that they deal with the client in their rooms, but then that client goes home, but the illness doesn't go away. They shouldn't be excluded from anything. I think everything that's available for people with physical illness should be available for mental illness as well. This is a particular kind of illness. These are physical problems. It should be regarded like a physical problem and treatment given accordingly, and services be available for people to understand what it is, and for the doctors and professionals who are working with the ill person to include the family. That kindness and the compassion and to help that person, whether you're the psychiatrist or whether you're the case manager, whoever you are that's within that treatment team, if you don't show kindness and compassion, you've lost your patient. You're not treating them properly, because with particularly mental illness, medication sometimes isn't only the solution.